Urinary incontinence rarely gets our attention, unless we have problems with it. It rarely gets attention unless there is a medical issue connected to it. Yet, almost 50% of women of the age 50 plus live with it. What's worse, 24% also suffer from bowel leaks, called fecal incontinence. While urinary incontinence is terrible and can limit activity, fecal incontinence is associated with shame, social isolation, and higher rates of nursing home placement. There's, of course, do-it-yourself treatment for urinary incontinence that's backed by medical data. It's Kegels, the pelvic floor exercises women are encouraged to do after childbirth. However, data show only 25% of Kegel enthusiasts do them correctly. That's why Renovia, digital-first healthcare delivering therapeutic and diagnostic devices for women with pelvic floor disorders, brought together some of the top clinical and business leaders in women's health to change the narrative of pelvic floor health. Our mothers and our grandmothers were told that leaking urine, or a sudden urge to go that they can't control, is a normal part of aging or a necessary consequence of childbirth. Our generation, and depending on their ages, our daughters, nieces, and granddaughters are still hearing this message. Urinary incontinence is common, and has been normalized, but it's not normal, shares Eileen Maus, CEO of Renovia. Maus is a healthcare and femtech veteran with 20-plus years of experience as a healthcare industry sales and marketing executive. Prior to Renovia, she served as Chief Commercial Officer of Constitutional Medical Investors, a portfolio company of Warburg Pincus, and in addition to participating in the diligence of diagnostic companies for potential acquisition, she also developed the commercial plan for disruptive technology in the hematology space that was acquired by Roche Diagnostic. In 1996, Maus was part of the Cytyc team that displaced the Pap smear with the FDA-approved ThinPrep Pap Test, which was the first improvement to cervical cancer screening in 70 years, another area of women's health that was ignored because 5,000 cervical cancer deaths a year was considered acceptable. The company's first product is the leva Therapeutic, an FDA-cleared device, a small vaginal probe, that can help women train their pelvic floor muscles to help treat urinary leakage. It combines patented sensor and app technology, enabling women to do their pelvic floor muscle exercises correctly and consistently, medication-free. Part of our mission is to educate women about this area of their health. For too long, pad and adult diaper companies have tried to position bladder issues as a normal part of a woman's aging. We're going to change that narrative by offering better care and educating women. Women want education and information about how to address the challenge of urinary incontinence.